Peter.
Hello, Tracy.
How are you?
I'm not too bad, thank you.
Good. I'm sorry that we had to change rooms. I know I said last week we would be in the same room, but as per as per the email I sent to you, we do need to use this room because the other one's booked. So
Oh, that's totally fine. I really like this room.
you like this one a bit warmer for you?
Yes.
Okay. All right, so once again we'll just go through a PowerPoint, and that's mainly so I don't forget to give you any information as we're going through, because when we get talking it's easy to lose your line of thought. So today's session is on stripping, cleaning and making a bed.
Yeah.
And that comes under the same unit that we've already started, the CHCCCS012, which is prepare and maintain beds. We proudly acknowledge the Australian, Aboriginal and Torres Strait Islander peoples as the first inhabitants of this nation and the traditional custodians of the lands where we live, learn and work. We pay respect to elders past, present and emerging. Once again, we're being filmed for assessment, so just so that you're aware of that and you're still comfortable with that. Okay, terrific. All right. In this session, we're going to look at dignity and privacy, managing a person's personal possessions, policies and procedures again around that, stripping and making a bed and cleaning a bed. Okay, so they're the things that we'll be looking at. So just once again, we're on the first floor this time, so from a work health safety point of view, if there are any emergencies and we have to evacuate the building, don't use the elevator, we'll go down the stairs. And the meeting point is at the front of the building. There are two other exits if we need to exit to get to the meeting point, so I'll guide you if there's anything like that. Just be really mindful that you're sitting comfortably, that you can sit and listen to me for half an hour, or we can discuss for half an hour. You would have walked past the toilets on the way in, so you know where they are. And if you need to get up and leave for any time, any reason, just let me know. All right. So, an icebreaker here that I've got for us to do to start our session is one fun fact that you're happy to share about yourself. And I'm happy to start with that, if you like, just so that, to give you some idea. So, one fun fact about me is that I learned to ballroom dance for a number of years. So I have received certificates and medals in ballroom dancing.
Oh, okay. That's amazing.
Something that's completely different to where we are and what we do.
Yeah, so that's very interesting.
Thank you.
Yeah.
Not that I'd be very good at it now. And unfortunately I have a husband who's not a very good ballroom dancer, so that's a whole other story. Have you got something you'd be happy to share?
I would say I can similar. Like I'm not a great dancer, but I really like to do a traditional folk dance.
Oh right. Okay.
So it is specifically done during this one particular festival.
Yeah.
It goes on for 10 days, and you dance every evening.
Oh lovely.
Yeah. So you dress up. You can't just be wearing normal clothes.
Yeah.
So I really enjoy that festival, and not that I can do great steps, but just the whole idea of dressing up and dancing with their friends and family. And which is coming in October, I think. Yes.
Right.
Yeah. So I'm looking forward to it.
Yeah. So I think sometimes when we do icebreakers in class, we wonder why we do them. But I think it just goes to show something like that there's so much we don't know about the people that we learn with, or the people that we work with, and that we shouldn't presume anything about people. So I think sometimes just little things like that are good to get to know each other a little bit better. You might find that if we did that in a bigger class, that there would be people who didn't want to share, and we have to also respect that in people that we work with and people that we learn with, that not everyone wants to share.
Yeah.
Okay. So on our previous session, we looked at PPE and we used the definition of equipment designed to protect individual workers from exposure to infectious diseases or hazardous materials. Okay, so that was the definition that we went by. We looked at types used for cleaning a bed in particular, and then we went through the gloves, the application and removal of gloves in that time. And I do recall from that session that you did that very, very well. That was something that you...
I really enjoyed that session rather than
Good. Thank you. Okay. So what was, thinking about the session, what was one important point that you got from that perhaps you didn't know prior to doing the session? Was there something that stuck in your mind as we went through things?
I thought making the bed is a simple task, like you really don't need to take all that many precautions, but I didn't realise that when you go in the hospital, you'll be dealing with, a linen that is soiled by blood or, fecal matter or things like that. So I did not think about the broader aspect of it.
Okay.
I was like, making the bed, it's an easy job, but when you think about it, it takes a lot.
Yes.
And
I guess we think that because we make our bed we should make our bed every day, and it's just a routine thing, but put it in a different setting, and there's very different requirements. Okay. So, and I think with when we're in another setting and we're dealing with people, and we need to be very aware of their dignity and privacy when they're in the setting. And there's different ways that we can deal with that, as this slide shows us, or different areas that we need to be aware of for people's dignity and privacy. And one of them is to actually maintain their physical privacy. Okay, so we'll do things like shutting curtains or shutting doors when we're in there. If somebody's got, as you raised, a blood-stained sheet, for example, the cannula's leaked and it's gone everywhere. Other people walking by when you're changing the linen don't particularly need to see that. So it's something as easy as shutting the door or shutting the curtain if they're in a 4-bed ward, and making sure that you have the patient covered at all times. There may be times where you'll have to make a bed with a person in it, and we'll go through that. We'll learn how to do that over the course.
With the patient in the bed.
With the patient in the bed. So there's steps you use and techniques that you use to roll the patient around the bed, move the patient around the bed. In those cases, you'd be doing it with a second person. So one of you is sort of making the bed while one of you's managing the patient, and then reversing roles. But at times like that, you need to make sure that the patient's all covered. If they've got a gown on, that it's not wide open at the back so that, their bottom's hanging out. That sort of thing for people. So we keep them covered. We make sure that their dignity and privacy is respected at all those times. Communicating respectfully with people, and whether we're making beds, whether we're serving them their lunch, whether we're giving them intravenous antibiotics, whatever our role is, communication is always really important with our patients. So we need to make sure that we explain what we're doing to them. So even whatever the procedure is, even in each of those 3 scenarios, there should be an explanation given to people. We should gain their consent if it's a procedure that's going to involve them. And we should always use respectful language. Okay, the way we potentially, may talk to our friends down the street or whatever is not necessarily an appropriate way to speak to patients. We have to have some level of professionalism about the way we do it. So gaining consent is as simple as, hi Peter, I've come in to make your bed. Are you happy for me to do it now? And they might say, no, I want to sleep a bit longer, yes, whatever their response, and we need to work around that. Okay. Autonomy and dignity of risk is another thing that we need to consider. And that's also a little bit related to communication and consent, because we need to allow choices for people and we have to respect their preferences. So little things like, if our policy tells us that every time we make a bed we put on the top a sheet, a blanket and a bedspread, for example, and the person says, I don't want a bedspread on, it's too heavy, okay? That's what our policy tells us to do, but we need, to respect what the patient wants. That's a very simple example, but we need to give them choice and we need to respect their preferences. We also need to be mindful of protecting their personal belongings and their information. So if somebody has their phone sitting under their pillow, for example, or their dentures maybe under their pillow, when we've finished making their bed, we do make sure that we put it back where we find it, unless we say to them, look, your phone's under your pillow, can I leave it on your bedside table? And that's something we have to be very mindful of when we are stripping beds, because we can find phones and teeth, and people may have had socks on and taken them off, or that sort of thing. So we need to be checking for those sort of things. So being very careful with their things, and also avoid discussing medical or personal information. So not only with the patient, if that's not your role, but also with your workmates in the tea room, or with a friend down the street who says, oh, I believe that Mary's in your ward, what's she in there for? Okay, we can't talk about things like that. We just have to let people know that it's not something that I can share outside of work. Okay. Sure. Is that do you think that's a reasonable sort of request, that we don't share information about people?
I think so, because I wouldn't like people talking about me.
And that's a good way of thinking about it. That we don't want other people to know our personal business. And sometimes you'll find patients will want to talk to you about things, and just be very mindful of keeping within the role that you're in. So if they want to talk about medical things with you and you're not medically qualified, of course we just have to say to them, look, I'm not a nurse. You'll just need to talk to the nurse about that. And then the other thing that the next thing we should be very aware of is cultural and spiritual sensitivity for people. So we need to respect culture, spiritual and even gender related preferences for people. So we need to be aware if there's anything in particular that people want or don't want. And it can be things like, some female patients may not want male carers to be in their room caring for them, even things like making their bed, if there's not another person there. So if they verbalise that to us, we need to put things in place. And even gender-related preferences, so being very mindful about how people like to be referred to, which can be very tricky, particularly if we're not so familiar with what their preferences are.
It's becoming more common, isn't it?
It's becoming a lot more common, and it should be in patient notes, and it should be handed over to each other if there's things like that we need to be aware of. So you're okay with all of those things? I think sometimes when we look at these things, we really just have to think about it's just general manners and consideration for other people, isn't it? It's not anything that's out of the ordinary, we would hope. Okay, so one thing we're going to just do now is a little bit of a role play, just between the two of us. Okay, do you feel comfortable with that?
What do I need to do?
Okay, so for the first one, what we'll do is I'll be the nurse and I'll be the person coming in to clean your bed, and you can just be sitting there or pretend you're lounging in your bed. And I'm coming in and I'm noting that your bed is visibly soiled with blood, as we've said in other scenarios. So what I will do is I'll come in and we'll just have a discussion of how I would say to you I'm going to change your bed. And what I would like you to do is to think about the language I use, the way I say things.
Yeah.
And then we'll reverse and for you to improve on what I'm doing.
Okay.
Okay? What pick out the things you think that I do wrong.
Okay.
And and then we'll do that. If you're not comfortable with doing it afterwards, we can just have a general discussion about it. That's no problem. So I'm going to come in, and the first thing I'm going to do is, I'm not going to knock on your door. I'm just going to come in. Hi, how are you?
I'm well, thank you.
You're all right? All right. I've just come to change the bed because you've got that blood all over it. So can you just get out of bed and I'll do it now?
Oh, okay. Yeah, I was having my lunch, but that's...
Oh, well, that's all right. It'll wait. It won't take a few minutes.
All right then.
Okay, so off you go and I'll do it.
Okay.
Okay?
Yeah.
Sit back down. That's not what we want, is it?
No.
No, that's not what we want. So how do you think you could improve on that?
So now I be a nurse?
You can be coming in to do that,
Yeah.
yeah.
Okay, so I'll knock the door.
Come in.
Hello, I'm Peter, your nurse today.
Hello.
How are you?
I'm good, thank
So
you.
you're Tracy Liston?
I am, yes.
Yeah. So I just wanted to come and check. I was planning to change your linen today. So whenever it's suitable to you, we can do that. But it's just that I'll have to get you out of the bed and then change the linen.
Can I just finish my lunch first?
Yeah, of course. Finish your lunch and just press your call bell and I'll come back and we can discuss and change the linen.
Okay. Thank you, Peter. That's
Thank
lovely.
you. Yeah.
Okay, so as you can see, it's very different the way you approach people, and the way you communicate with them, isn't it? So mine was a very aggressive, dominating sort of way, and your reaction to that was just, oh, okay, I'll do it.
Yeah.
You know,
I was like, I'll do anything you tell me to do.
That's right, because it was a bit intimidating, wasn't it?
It was, yeah.
Yeah.
I would never want to be spoken to like that.
No. So they're the kind of things we need to think of. And once again, your approach was lovely. It was calm, it was respectful. You knocked on the door before you came in, so you didn't come barging into my room.
Yeah.
You basically got consent in the fact that yes, we will do it after I've had my lunch. So you were very mindful of everything. So that's terrific. That's exactly the way that we need to approach people when we're doing these sorts of things. We may get, pushback from the people on occasions, from the patients on occasions, where no, I don't want you to change it, even though it is potentially visibly soiled. So we can, usually come to some compromise with them about the way we manage that. Okay? All right. So once again, so we know we're going to have to clean this bed that has got blood on it, but what we need to know is when do we need to clean the beds, what's the procedure, what PPE is needed, of which we had previously looked at in the last session, and what are the steps. So once again, we've got our policy and procedure.
Thank you.
We might just have a look at it on here. So when we have a look at it, it gives us a purpose. So we're just looking at the policy and procedure just in a little bit more detail than we did before. It gives us the purpose of what we need to make the bed. It gives us the scope, so who's doing it, and then it goes through other sort of requirements about it until we get down to the preparation, the procedure and preparation, and that's where we saw last time that the PPE that's there and what we need. So we're fully aware of that. Looking back at number 3, the policy statement, it's telling us that hospital beds and patient room equipment must be cleaned and disinfected between patient admissions daily during patient occupancy, immediately after contamination with body fluids. So that would come into our scenario of having blood on the bed. And during outbreak management or when multi-resistant organisms are present. So that would be in things like a COVID outbreak or a gastroenteritis or flu outbreak. Okay, so that's giving us this information that we need. We can always go and gain further information, like I said about the PPE with a senior person. Okay, so whether it's the nurse, the senior nurse on the ward, the manager, the head of housekeeping, any of those sort of people are able to give us that information. And it also tells us that all cleaning must comply with the National Safety and Quality Health Services standards and the Australian guidelines for the prevention and control of infection in healthcare. Okay, so there's other things that we can look at if we do need more information. And then when we turn the page over, it actually gives us all the steps that we need to do. So it's very clear for us the type of things that we need to do while we're cleaning the bed and then making the bed. So all of that is there for us. So as I said, this will be available in different forms in places that you work, not so much in hard copy these days because things change if they can get missed and not updated. So it would be an online thing. Of which, if you're not sure to find it, where to find it, once again, you know, there's people there that can help you. Okay, is that? Yeah, that's pretty clear. And it's good that it gives you all that information.
Yeah, it's good that there's a direct step that you need to follow.
Yes, that makes it easier. Okay. We're going to have a quick look at a video now that is just a couple of staff making an unoccupied bed. Okay, so there's no one in this staff. There's a few points that I'll bring up with you about it afterwards because there's a few things in it that, you know, potentially we may do a little differently. This up. Screen, it did. I've still got it on mute.
Explain the procedure to the resident and encourage them to participate as appropriate. 3.
Sorry, I have somehow got the wrong video there. Sorry about that.
It's okay.
So I have got up there that it's making an unoccupied bed. Okay.
Nurse aid skill number 12. Making the unoccupied bed. Step 1. Properly wash your hands before the procedure as appropriate. 2. Assemble the appropriate equipment and place it in the appropriate place. Number 3. Begin with the bed in a flat position and elevate it to the appropriate height if possible. Lower the bed when complete. Number 4. Remove the soiled linen and place it in an appropriate place. Five. Avoid shaking and touching the linen to the uniform as much as possible. Step 6. Apply the bottom sheet to the clean mattress, keeping it straight and centered. 7. Make all clean bottom linen tight and free of wrinkles. 8. apply the top linen. Number 9, apply a clean pillowcase to the pillow, keeping zippers and or tags on the pillow to the inside of the pillowcase. And step 10, leave the bed completely and neatly made according to facility policy.
Okay. There was a couple of things on that video that perhaps weren't as ideal as we would like them to be. One of the things is that they didn't appear to change their gloves after they removed all the soiled linen. So we learned from when we put our gloves on in the last session that, you know, once you've done your procedure, they become dirty as such, so we need to remove them, and they didn't do this. So that's one thing that we need to be mindful of, that, you know, it wasn't done in the way that we would potentially like it to be done. But as you saw, they moved all the, sort of folded it up so that the linen was all together and neatly in a pile, and then removed it. We need to be very mindful about not touching our clothing, so that's where we have our apron on. So depending on facility policy, you could potentially have an apron on there so that you don't soil your linen. Is that your uniform? Is that was that self-explanatory enough for you? It was clear. Yeah. Okay then. So the other thing is, you know, making sure that you have all of your. You don't want to see the next slide, do you? Making sure that you have all of your equipment ready to go. As per the policy. You may find that some places will have underlays, some places will have overlays. It just depends on your facility to be able to, we'll just scooch back through to where we're up to. Okay, oops, sorry. Okay, so we had a look at that. There is another reference on here when you have, if you want to have a look at your PowerPoint when you're at home, and it's a much longer version of the same thing. We're not going to spend time looking at it now, but it does go into a lot more detail if you think that you would like it. Okay, so we're going to go straight on to another video at the moment which expands on that even more. It's only another couple of minutes, and it's about cleaning the area. So we've looked at stripping our bed, but we will...
Park again? Got to brush every night?
I'm going to start printing that instead of doing what I wanted to do. Sorry. Terrific, okay.
Hospital terminal room cleaning, or unoccupied patient unit. A terminal discharge unit is a patient recovery room that has been vacated by a patient. The unoccupied room left behind by that patient is called a discharge unit. It was contaminated by the patient and needs a thorough disinfection and cleaning to prevent cross-contamination of infections. Hospital-approved goggles or other eye protection should be worn when there is a risk of a chemical splash to the eye or risk of patient blood or body fluid splash exposure. Put goggles on your face, adjust them to fit. The steps you will have to perform to professionally clean the discharge unit are: 1. Remove all soiled linen from the room. 2. Remove any patient equipment from the room. 3. Check sharps container. When handling soiled linen, always fold the edges toward the center, and when carrying these items, don't press them to your body. The less these items you touch, the better. Wipe clean all surfaces of the mattress. This means tops, sides, and bottoms. Remember to inspect the mattress for any damage, such as tears in the fabric. Report damaged mattresses to your supervisor. Step 8 calls for the cleaning and disinfecting of the discharge unit equipment and furniture. Move clockwise from the door and sanitize all equipment, skipping the restroom. One last point. When you are through cleaning a discharge unit, discard the protective gloves that you were wearing in the trash. And wash your hands thoroughly. The cleaning procedure we have just reviewed will ensure a clean environment for the next patient to occupy this room.
Okay. So we saw a couple of things in there, you know, how to wash the bed, the use of PPE again, of the gloves. Once again, they didn't wear aprons, potentially not in their policy, but depending on where we are, we may need to. And when we go through it, we will do using the aprons and everything, just so that we're over-prepared rather than under-prepared. Okay, have you got any questions on that?
No, that was pretty good.
Pretty clear?
Yeah, very clear cut message.
Okay. So when we're cleaning a bed, these are the steps that that we've just spoken about. And once again, you know, there's the sanitizing, the wearing your gloves, the doing all that. Adjusting the bed is a really important thing, and we will have a quick look right at the end of this presentation on how we adjust a bed, because we want to make sure we don't hurt ourselves. We want to have everything in place. So removing the soiled linen. We also have to remove any other patient equipment that may be there. There may be a portable IV pole, for example, so we need to clean that down and remove it. Remove all the rubbish, use neutral detergent unless otherwise required, allow the bed to air dry, remove our gloves, and sanitize our hands. Okay. So I think rather than us writing down all the things that we've just spoken about, we will also just have a quick chat about what, making a bed, what sort of things do we have to remember for making a bed? What are the steps?
A bed.
To make a bed.
Do you need a bed?
You need a bed, you do.
Identify why you cleaning and
Yeah.
what's the reason.
Yeah.
Like, you know, if it's a daily clean or a terminal clean, as the video said.
Yeah.
Or if it's contaminated by something, or you just need to strip the whole linen off
Yeah.
because it's dirty. So so that they'll tell us what PPE to wear and what to do. And then we go and see if there is a patient or there is no patient.
Yeah.
So we determine that. And then we do our hand hygiene, put some gloves on or whatever PPE
Yeah.
is required. And then we strip the bed and fold it inside, so we're not, you know, spilling whatever's in the sheets outside. We're not causing any cross-contamination. Keep it away from ourselves, like
Yeah.
away from our own clothing. Dispose in a skip, and then change the gloves, because those guys didn't change the gloves.
Yeah.
And change the gloves and get the new linen, make the bed as the hospital policy says. And then come out, remove the gloves, and then hand washing again.
Great.
Yeah.
Yeah, you've certainly got your head around that. Good job. Good job.
Yeah, I think so. But doing that is a different thing. Like, it's all fresh, but by the time I get to the bed, I'll probably forget
It will be
something.
different. And we will have practice sessions prior to you
that's
needing to
good,
do
yeah.
that. Okay. So when we have some lab sessions, we will then be going through.
Yeah, okay, that's good. Yeah.
So that'll just reinforce it for you.
Yeah.
Okay. Have you got any questions on those things?
No, I think it's pretty good, but yeah, certainly I must practice when you allow us to.
Yeah, we will go through them. That makes a
Yeah.
huge difference. difference.
Yeah.
Okay, and that's what we've just spoken about there. How to clean a bed. So this is an example of the type of control that you will see on beds. This one's actually on the side of a bed, or there can be a hand control. Once again, when we're in the lab with the beds, we will look at it more thoroughly.
Yeah.
But I just wanted to give you some idea that, you know, we need to be really mindful of having our bed at the right height. So if we have a look at the control along here, it gives us the different parts of the bed. So this one will do the knees, this one will do the head up and down, and this one will do the whole height of the bed.
Yeah.
So this is the one particularly that we would be really mindful of when we are doing a bed, so that we have it up at hip height.
Oh, yes.
And that we're not bending over
Right.
and risking hurting ourselves. So we will look at that in more detail, because not only do we need to do the height, we need to make sure the brakes are on. So when I can show you the bed, that will be a lot easier.
Yeah.
Okay, so just a couple of quick questions for you.
Yeah.
That we'll just do them together, I think.
Yeah.
It is not necessary to maintain privacy of a patient. Is that true or false?
To not maintain privacy.
Yeah.
I think we all like privacy, isn't it? So it's false.
It is false, that's right. We should always maintain patient privacy.
Yeah.
We should allow choice and respect preference of a patient, even like when making their bed. Is that true?
It's our choice or their choice?
We should allow them choice.
Oh, okay. Yeah. I mean, sometimes if they refuse, we don't give them choice, do we?
Okay, we still have to respect their choice, and we have to work around it. So we may be able to compromise.
Yeah.
We may be able to
Okay.
compromise on it.
Okay.
So as a generalisation, we should allow choice and respect preference.
Okay, yeah.
Yeah,
okay,
that's
yeah,
true.
Yeah.
Facility policy and procedures should include information on PPE, frequency of cleaning, and steps to cleaning.
I think that's true.
That is true.
Yeah.
We have seen that in our
So this one
policy that
tells
we
us,
looked
yeah.
at. Yeah. Gloves are not required when stripping a bed. Is that true or false?
I would have a glove on because you don't know.
You don't know what
what's
you're going to
on
find,
the
do you?
Yeah.
So that's a false statement. You do not need to clean a bed if soiled, if the same linen is being used. That's a bit of a tricky one.
Yeah.
So if there was blood on a mattress, for example, do you think it would need to be cleaned away before you put clean linen on the bed?
But how would the blood get on the bed? Because there's sheets there.
So if sometimes if people have a wound that bleeds a lot, it can soak through the sheet.
Oh, okay. So that's a big bleed. Yeah, that we have to change, isn't it? Because otherwise stay in the new sheets.
Yeah, that's right, and we do have to clean it. And when we look at our policy, it does say immediately after contamination with body fluids.
Oh, okay.
Okay, so as soon as we can, or as soon as it's identified, if it's bled, we will do it. Okay, and neutral detergent or wipes are suitable for general cleaning of beds and furniture.
I think that's okay, isn't it? It's true.
Yeah, that's true. And if there is any further requirements, well, that will be done. Okay. Excuse me. So we have finished our couple of sessions now. Once again, if there's anything that you need, please email me. You know, if there's further information or anything that I've not spoken about clearly enough for you, let me know.
Yeah, thank you.
There is one thing that we need to do, and I hadn't mentioned this to you earlier because I didn't want you to be worrying about it and be thinking about it the whole time, is that I need to get a little bit of feedback from you on how our sessions have gone. So the options are that I have got it printed out here, that if you want to, I can go through it with you, or you can go in to the Moodle shell, and it will be in there, and you can just do it electronically and send it through to me that way. So
I think
it's
I've done
how,
it in the past.
yeah.
There's no answers to write, isn't it?
No. So this asks you a series of questions about the session
Yeah.
and whether you agree or disagree that.
Yeah, I think I can do that for you.
Yeah.
Yeah.
So would you like to do it on paper or you want to just do it in your own time without me?
I think I'm
Yeah.
a bit exhausted
Okay.
at the moment, so
Yeah.
I can go online. And
Do it
for
online?
you.
Okay
Yeah.
then, alright then. I would really appreciate if you can have it done
Yeah.
by the end of tomorrow. Is that giving you enough time?
Yeah, I can do tomorrow morning.
Okay then, alright. Just if we leave it too long, obviously we forget to do things and
Yeah,
it
yeah.
might be missed.
No, that's okay. You've done such a wonderful job,
Thank
Tracy.
you.
Thanks for helping me.
That's okay, thank you. And as I say, anything you need clarified, please just let me know.
Yeah,
Okay.
definitely will do.
Alright, thank you.
Thank you.